Welcome, everyone. I am delighted to welcome you all here. Thank you so much for coming to join us on this rainy day. My name is Jen Lansford. I'm the director of the Center for Child and Family Policy here at Duke. And it is truly a pleasure to have Dr. Damour here with us today. Just as a little bit of an introduction first, the Center for Child and Family Policy sponsors the Sulzberger Distinguished Lecture Series as a way to stimulate the intellectual community, not only for our own faculty and researchers and staff, but also the broader Duke community, the broader North Carolina community, and now thanks to our virtual reach, people nationally and internationally. And we have many people joining us on Zoom today, so we welcome those folks as well. We are really grateful to the Arthur Sulzberger family. This whole lecture series is made possible by an endowment from the Arthur Sulzberger family. I'd particularly like to thank Cynthia Sulzberger and Stephen Green for their generous support. So we're very fortunate to have Dr. Lisa Damour with us today. Dr. Damour is a clinical psychologist and the author of 3 New York Times best-selling books on adolescents' mental health and emotional lives. Those books have been translated into 23 languages. She has a dynamic podcast and reaches audiences that are both academic as well as parents and policymakers. She collaborates with UNICEF on a number of issues internationally and has a connection with Case Western Reserve University. We're very fortunate to have her. She's even consulted for Pixar on Inside Out 2. And great, thank you very much. Thank you very much for being with us, Dr. Damour. I turn it over to you.
Thank you so much. I got a mic here. That's all right. Okay, thank you for that lovely introduction. Thank you all for being here. Despite the weather, you get extra triple points for showing up in person today. I want to thank the Sulzberger family for making this possible. It's an enormous service, and I'm very grateful for the opportunity to be part of it. I also want to congratulate you on the 25th anniversary of this Child and Family Policy Center. That's a really big deal. I have the honor of being connected to the Child and Family Policy Center at Case. I know how important these organizations are because child and family policy spreads across so many disciplines that you do actually need organizations that knit them together so that we're all thinking about what we can do right and do best for kids and their families. So this is going to be an enormously wide-ranging talk. I'll talk for about 55 minutes or so, and then we'll have lots of time to think together. But I got it ready. I was like, this is like an intro psych class where you go like skidding across all of these things, barely giving them the, consideration they deserve, going very shallow, not deep on anything. That's what you're in for. And I feel like I should just warn you out of the gate about that. My hope, though, is that in really trying to take a very broad view of what teenagers need now, that there will be a little bit of something for everyone. However you have come to this, whether you're coming at it, and many of you may be wearing more than one of these hats, if you're coming as a parent, if you're coming as a researcher, if you're coming as a policy person, if you're coming as a public health person, if you're in the media, if you are an educator, I hope that there will be more than a few things that for each of you feels personally relevant. My plan is I'm going to bring across a public health approach to how we think about adolescent mental health concerns, and I'll detail that more. I'm going to talk about what I recommend, what I think we should be doing at every public health level. I'm going to talk about adjustments that I think we're ready to make, or we have enough data to know that we should probably make some adjustments. And I'm going to talk about where I see the holes in the research. I am highly dependent on the research of academic institutions. I use them all the time. And there are gaps in our knowledge that we need to fill. Let me start by saying it's just my opinion, right? This is just my view of the survey of where we are right now. It is incomplete. It is almost certainly imperfect. I'm going to talk about the work of several excellent colleagues in the field that by no means should suggest that this is a comprehensive take on where all the good work sits. There's work that I won't mention. There's work that I don't know about, but it's where I'm coming at it. Why me, right? Why do I get to have this wonderful opportunity? I don't really know why, but what I can say is that I find myself very interestingly positioned right now as a psychologist. I get to do a great deal of public-facing work, and I'll talk about that a little bit. I stay closely attached to the academic universe and trying to pay attention to it. I get to work on the policy side. I get to think with people on the funding side. I generate a lot of media. I respond a lot to the media. I think about these things. I am married to a teacher, and I have a 13-year-old and a 20-year-old myself. So teenagers run through my life in a lot of different ways. And so if I am able to try to synthesize that into something that can bring across, it's certainly not neutral, it's my view, but a sort of more comprehensive way to think about adolescence and where we are, I hope that I can do that. Okay, so here we go. Adolescent mental health crisis. Let me just start by saying I have done teenagers for 30 years. And it used to be this niche-y little thing over here. And then along came the pandemic, it moved into the mainstream, and it seems to be staying there. And so we're talking about the adolescent mental health crisis, and this is important. But I want to just unpack for a moment how we got to an adolescent mental health crisis. So what I can tell you is we have plenty of data showing that teen distress was rising pre-pandemic. We have data looking 2009 to 2019. We are seeing growing rates of depressive symptoms being reported, growing rates of anxiety symptoms being reported. It's not that this was great or flat prior to the pandemic. Then came the pandemic. It was awful for everyone. It was awful for teenagers in a particular way. And what I mean by that is that teenagers have two jobs. They are supposed to become as independent as possible and spend as much time with their friends as possible. And the pandemic just took the legs out from under them on both. And so it was not equally awful for all teenagers, but I will say it was developmentally, it sort of T-boned teenagers. And I think we need to take that very seriously. The other, I would almost say half of what accounts for the adolescent mental health crisis is that we do not have the workforce we need to care for teenagers. We never have. If you were trying to find counseling for your teenager pre-pandemic, you could not. Along comes the pandemic, huge surge in distress in teenagers. We are completely incapable of suddenly scaling up our workforce to manage that. So when we talk about the adolescent mental health crisis, there's a very heavy focus on the teenagers, understandably. I would also like to push on the idea that there should be a very heavy focus on provision of care, because we had those gaps and those are now worse. Okay, so this is a big problem. Here's the good thing. We are used to dealing with big problems, and we have systematic ways to deal with big problems. And I am not a public health person. I love the public health approach. So public health approach, and then we're just going to walk through this step by step. Primary prevention, these are population-wide interventions. So if we sub out mental health for dental health here for a minute, this is the fluoride in the water. What is the fluoride in the water that protects teeth? So what is going to be the fluoride in the water that protects teens? Secondary prevention is whether there's a high risk or the beginning of a problem. So at the dental health level, we're talking who's not brushing, who's eating too much candy. Let's turn this around before it becomes a problem. Who has the start of a cavity that's not yet really a cavity? We're going to think about those equivalencies in adolescence. Tertiary prevention, you've got a cavity, right? We need to both address it clinically, and we need to try to keep it from coming back or more cavities from coming. So tertiary is, what are we doing clinically for teenagers, and what do we need to provide? All right, so starting with primary prevention. So this is the fluoride in the water. What is it that all teenagers need everywhere to protect adolescent mental health? So I'm starting with the most boring thing we got, very deliberately. Sleep is the least controversial, and I would argue, if not the most, one of the most powerful things that we can do for teenagers. It is foundational to their overall health. It is something that we are so good at studying because it's actually really easy to study. What we do is we bring you in a lab, we give you a fabulous night's sleep, we give you a bunch of measures. We bring you back in the lab, we keep you up all night, we give you the measures again, right? I mean, like, this is not hard. When we do this, what we find is that sleep makes learning better, processing speed better, attention better, focus better, mood better, emotion regulation better. You like yourself better. You like other people better. You're less likely to have an accident of any kind. It also, suicidality runs through sleep. Everything we say we care about in teenagers hinges heavily on how much they are sleeping. There is zero controversy. I will also add, there's some beautiful work being done by Adriana Galvan at UCLA about sleep in adolescents in particular. And given their neurological changes and given what's happening for them developmentally, it's that much more important for them. And she also looks at these wonderfully precise things like, if you show an adolescent who's exhausted something that seems threatening, it seems much more threatening, right? If we care about mental health, we have to care about this. Okay. This is the kind of data we are finding. This is from a paper by Andrew Fellini and Adriana Galvan that was in Nature. So when we talk about worsening adolescent mental health, we have to map it on to what we know about sleep. And just for you, so you know, the axis for the sleep is proportion who report less than 7 hours of sleep a night, right? So look at how much that's going up. And I'm sure it's not improved since these data came out. Now, to just really underscore how seriously I take sleep. So I continue to practice as a clinician. And one of the things I have learned as a clinician is I actually will not diagnose a sleep-deprived teenager. That if a teenager comes my way and they are exhausted, they're going to look depressed, they're going to look anxious, they're going to look like they have attentional problems. And it is irresponsible for me as a clinician to start throwing those labels around until I get the sleep under control. And that, to me, I think we have not done a good job clinically of making it clear how central it is. So if I have a kid who's not sleeping, I put all my chips on sleeping, we get them sleeping, and then we see what's left. What's amazing is how often the picture is very different once that kid is sleeping. Which is to say, everything else I say after this, it's kind of a rant about sleep, is a Band-Aid if sleep is not managed. Okay, so here's what I think we should do. Number one, delayed school start times. These work. We have data, they are effective. This is a policy, this is a legislative thing, it matters. Insert here a whole lot about adolescent sleep phase delay, teenagers stay up later, they have a harder time getting up in the morning, this is important. But this is something we can do that we know makes a meaningful difference. Number two, public health campaigns to build awareness of how much sleep teens actually need. All right, this is fascinating to me. We have studied this. Peak mental health, first of all, backing up. If you just ask your pediatrician, they will say high schoolers need between 8 and 10 hours of sleep. High schoolers need an average of 9 hours of sleep a night. Middle schoolers need an average of 10 hours of sleep a night. Elementary school and younger need an average of 11 or more. If you stop an educated, informed, caring adult on the street and say to them, how much sleep do teenagers need? They'll be like 7.5 to 8. They're an hour under. This is just one of those places where we've done a terrible job of translating what we know. And we have data showing very clearly peak mental health for teenagers happens between 8.25 hours and 9 hours of sleep. So if we say we care about sleep and we say we care about adolescent mental health, we have to help people know this, because I think there are a lot of kids and parents who would get that kid more sleep if they knew the target numbers, and they just don't know the target numbers. So this is ripe for a public health campaign, absolutely ripe. Then we have to look at why individual kids don't sleep. And this is fascinating. A major factor is technology and where their technology is. We're going to come back to the question of social media. I will tell you the studies that look at does social media use disrupt sleep have much sturdier findings about then predicting to adolescent mental health problems. The link between social media and sleep is much looser than that if it's there. There are also kids who don't sleep because they're working an extra job to support their family. And that's something we need to think about. There are also kids who don't sleep because they're working so hard in school And one of my least favorite findings, but I really appreciate the science, it tells us what we need to know. Optimal mental health is found at 8.75 to 9 hours of sleep a night for teenagers. Optimal grades are found at 7 to 7.5 hours of sleep for teenagers. All right, so we got to deal with that. We have to deal with that, especially given what we know about the mental health implications. All right, we're just going to keep going. Intro psych, new chapter. Okay. The next thing we need to do by way of a public health fluoride in the water intervention is to surround teenagers with caring adults. So as grim as the last, what is it now, 5 years, 4 years, 5 years since the pandemic started, as grim as it has been for those of us who have teenagers, care for teenagers, the thing that lets me sleep at night is that one of the sturdiest findings we have is that the single most powerful force for adolescent mental health is strong relationships with caring adults. We know what matters. It's in our hands. We can do a lot with it. So we need to have the adults around teenagers be exactly who those teenagers need them to be, because that's exactly what we know makes a massive difference in overall mental health. So how do we do it? First, we educate adults around teenagers about typical adolescent development. Okay, this is mostly where I live. This is mostly my work. This is what my books do. This is what my podcast does. This is what my Instagram does. I've become a huge fan of social media as a way to disseminate information. You have to find people where they are. Don't make it hard. We know that teenagers are not like kids. We know that what worked to discipline your kid does not work to discipline your teenager. We know that if it's a healthy teenager, they become increasingly private. We know that if you have a healthy teenager, they stop picking up what we are putting down, right? They become much more skeptical. We know that their job is to try to spend as much time with their friends and as little time with us as they possibly can. This is all healthy, typical, expectable development. We are in a time where people don't know this. And I am aching at some of the questions I get from families where they're like, is it normal that my kid doesn't tell me the same amount of stuff she used to? And I'm like, oh yes, absolutely. So we just need good, broad-based developmental level setting about what to expect when you're expecting a teenager. Okay, we need to make teaching an attractive profession. Okay, amen, amen. My younger daughter's in the 8th grade, and we had back to school night, not that long ago. And I just want to go up to everyone and be like, thank you, and thank you, and thank you. And what I want to thank them for is not only are they there, but they're like, they love middle schoolers. And they are teaching science while also being like, okay, what's the T, right? I mean, that they are fun, they are connected, they are engaged, they are interesting. Let me tell you this, people who are good at teaching can be good at lots of things. They don't have to teach. And what we are seeing already, and we're going to see more of it, is if it is not worth it financially to you to do this, if you are too scared of guns to do this, if you are, I mean, all of these things that make teaching so much harder than it needs to be or should ever be, we're going to lose good people. We are losing good people. And the problem is what I think we're going to end up with, and I think we have a little bit already, is what I would call a warm body problem. We're going to end up with people who are in those jobs who are not like super into kids, right? Or don't even like kids, which sometimes happens. This is a major fluoride problem. We need to treat it as a major fluoride problem. Okay. Single most powerful force for adolescent mental health is strong relationships with caring adults. In teenagers, this is increasingly adults outside your home. This is the nature of adolescence. You loosen ties at home, you strengthen ties outside the home. The headline here is lots of kids are saved by their theater teacher. In the pandemic, I had an incredible opportunity to talk with the superintendent of Chicago schools. And he said something, I was like, how has nobody else said this? Or maybe I've missed it. He said, if we think about where adolescent mental health went wrong in the pandemic, it wasn't just that they were home. It wasn't just that they were isolated. They lost all their contact with their coaches. They lost all their contact with their after school people. They lost contact with the hall monitor who knows them and asks them what they thought about yesterday's game. These adults are critically essential to health in our teenagers. They are the ones who are actually fluoride all day long. I will also tell you, they often can be culturally resonant with kids, right? That they often are coming from the same communities. That is hugely, hugely valuable. We are also going to need to do some remediation academically for a lot of kids. I'm not going to spend a lot of time on learning loss. This is critically valuable. We need wonderful, wonderful adults doing that work with kids because it's a mental health intervention. And that's what I want to say. If you take, I mean, I hope you take a lot from this, but if you take one thing, arts programs are mental health interventions. Good coaches are mental health interventions. Service programs are mental health interventions if they put kids in the path of a caring adult who becomes somebody they count on. Okay. The third thing is we need to ask a lot of teenagers. And this is an interesting moment, and I'm going to come back to this, but the discourse around teenagers right now is around them being quite fragile and us worrying about how much we can ask of them. And yet we have this really quite extraordinary body of research showing that teenagers are dying to make their mark on the world and that they benefit when they do. This comes from a lot of people, but I want to actually focus for a moment on the work of Andrew Fellini, who was one of the people on the paper I showed earlier, also at UCLA. And he has spent a lot of time studying this. And in a private conversation, or a conversation we had, he said to me, it's just really that teens need to feel that they are counted on. Okay, this to me felt really important because usually when this research gets talked about, it's talked about in terms of teens having a sense of purpose. Okay, I went to college with this really funny woman, Molly Devaney, and she wrote a piece and she's like, how can my kid have a sense of purpose? He can't even find his shoes. I was like, I think a lot of families feel like that, like purpose, like, are you gonna cure cancer yesterday? Like, what are you doing? And so I think sometimes the discourse around purpose actually shuts people down. It feels too ambitious and too hard. And so I wanna push a bit on, the way that Andrew Fellini characterized it to me. He's like, they need to feel like someone's counting on them, that we're counting on you for all sorts of things. So they need to have chores. They need to have responsibilities, involvement in family decision-making. You are a member of this organization. We need you to do your part. They can roll their eyes. They can grumble. One of my favorite educators says, complain but comply, right? I don't care, right? And in those moments, it's, we need you. We need you. You can also go big, right? They can be mentors and tutors, parts of teams, leadership roles, involvement with social causes. To double back, usually this involves some pretty fantastic adults they should probably be hanging out with outside the home anyway. This is a really good thing. This is valuable in its own right. We have tons of research to show it. The other thing I want to underscore about when teens are felt that they are counted on, like a teen who's maybe mentoring or tutoring a younger kid. Service, especially, is one of the most reliable sources of self-esteem. And I think about, teenagers, I wouldn't say they're fragile, but they have their ups and downs. And they often feel like they're being measured against one another, or they've gone to school to be sorted. And I think there's something so important to say about for the kid who, gets a grade they didn't like or kicks an own goal in soccer and who may be feeling really bad. If you're taking care of somebody else, you really can't mess that up. And so I think for all teenagers, and maybe especially teenagers who don't get showered with all the accolades that we do hand out, which is a very narrow band, we need to think about helping them understand that they are counted on, they are needed, they are valued, they have a huge amount to contribute. Okay. Adjusting current approaches. I wish this were not what I was about to say, but here's what I'm going to say. I am very glad about the exuberance of expanding social and emotional learning in schools. I think we're starting to see some data that tell us that we need to think again about how we're going about it. So here's what I mean. And I'm drawing here, there was a really excellent op-ed by Darby Saxby, who's at USC, in the New York Times. The title was, "This is not the way to help depressed teenagers." And unfortunately, what we are starting to see is that some of the social and emotional learning programs are actually leaving kids feeling worse. Talking a lot about depression, talking a lot about anxiety is actually seeming to not help them feel better. All of this is well-intentioned. I have no issue with the fact that that's been the effort. I also think we have to be empiricists. We have to look at the data we're getting. In terms of why this is happening, Lucy Folks at Oxford does some very good work on this in terms of like prevalence inflation. Right, if we talk about depression a lot, it can, for kids, become murky, like, well, maybe my sadness is depression, right? Maybe my nerves are an anxiety disorder. I had a wonderful conversation at lunch about sort of this dual thing of like, we've worked so hard to reduce stigma, have we overcorrected? I think the way we can position ourselves, it's like kind of like the medication of ADHD. We are both under-medicating and over-medicating simultaneously, depending on the population. There will always be groups where mental health is unhelpfully stigmatized. We also need to be thinking about what it means to use, and I'm just making this term up, to have sort of a pathology forward approach to social and emotional learning, that it may not be working the way we want it to. Okay, so what would I propose instead? So I think we should have social and emotional learning. But if I were the queen of the world, I would have it focus on accurately defining mental health. The definition I have been prosecuting, which is not, I mean, I'm just bringing across the field as we know it. Mental health is not about feeling good. It is about having feelings that fit the situation and managing them well. Full stop, end of story. Psychologists are totally cool with distress. In terms of normalizing distress as a part of life, we need to do this. I'm just going to flat out blame the wellness industry for all of this, right? That they have given us the idea that there's somewhere out there some emotional zen, and if we just have the right products, the right practices, do all the right things, we can get there. That is not true. It doesn't need to be true. Further, distress is helpful. It orients us. It gives us feedback. It motivates us. I cannot tell you how fun it was to work on Inside Out 2. Like, so fun. Like, so fun. In May of 2020, I got a call, Pixar wants to talk to you. I get on a Zoom with Kelsey Mann, the director, Meg LaFave, the writer. They're holding Untangled and Under Pressure, and they're like, we want to talk to you about a movie. I'm like, oh, yes. Okay, I was saying, work is work, and most work, you're like, it's fun, but then there's downsides. This was like total fun. Like, this was like the most unambivalently fun thing I've ever done. And I am so impressed by what they delivered in the end. Because what they delivered in the end is this. There are now 9 emotions, only 1 is considered a pleasant one, right? Only joy. The other 8 are all uncomfortable emotions. They are not pathologized. They are part of the team. They take care of Riley. They all have their place. They all have their role. So Disney's doing a bang-up job of getting this idea out. Schools need to be doing a bang-up job of this. Schools can be using this movie to do a bang-up job of this, right? I mean, that happens all the time. I think they should do that. So we need to do that. I do think it's really helpful to focus on healthy versus unhealthy coping, right? So if we go back to my definition, mental health is not about feeling good. It's about having feelings that fit the circumstance and managing them well. Coping is how you manage. So I think there's a lot of room in classrooms to talk with kids about healthy coping is fill in the blank. Sometimes it's mindfulness. Usually for kids, it's listening to music, going for a run, talking to their friends, cuddling their dog. Right? Kids have a very wide repertoire of healthy coping, which we don't always acknowledge. Unhealthy coping, substance misuse, taking it out on other people, taking it out on yourself. That's what we want kids to steer clear of, but them having bad days that they manage by cuddling their dog while listening to their sad playlist, that is the picture of health. That is exactly what we are looking for, and we need to reassure them of that because I don't think we've done a good job. Now, there is a place for talking about pathology and social and emotional learning. And it is in letting kids know what they need to let adults know about. So here I will tell you that I had an incredible opportunity. For 20 years, I consulted to a school in my community. And I was there a day and a half a week. It's a girls' school, private school. And when I got there, we were going crisis to crisis. And I was like, we can't do this. First of all, by the time a kid's in crisis, they've been suffering a long time, and that's way too much suffering. Second of all, crisis to crisis is terrible for systems, right? It just sucks up everything. So with the blessing of an incredibly psychologically minded head of school who basically gave me ridiculous latitude, I developed a system at this school where in life skills, which was our social and emotional, I focused on, and this is inelegant, I called it the bucket of 5. I wish I had come up with better branding, but now I'm stuck with this. Bucket of 5. So we would talk about things, and then I would say, okay, there's 5 things. If you know about them, in yourself or a peer, you need to let an adult know. Depression/suicidality, and we would do a quick, like, what are you looking for? Not a dissertation on these things, but what are you looking for? What are the signs? But you don't have to be sure. Self-harm, you don't even have to go into detail on that. They know what that is. Eating disordered behavior, not a lengthy, here's how to have an eating disorder, which we have seen data showing that you can teach kids how to have eating disorders. We don't do that. But instead, these are incredibly dangerous, and you know before the adults know who's suffering. Out of control behavior on the weekends. And what I would say to them, I'm like, we know you drink. I'm talking about the teenagers who scare other teenagers. They're like, oh yeah, no, we know exactly. Like, it's a very clear definition. And then finally, danger, right? A dangerous relationship, a peer who feels dangerous, danger at home, like where there is jeopardy. And we developed systems where we were always reminding them, these are the 5 things. If you know about them in yourself or a peer, you need to let an adult know. And we were very clear. We were like, it's not because we're adults and you're teenagers. It's because you don't have clinical training, right? This is like, this needs to go to a certain adult. And so we're here to help you have it happen. I will say, we also happen to have an enormously trusting relationship with the students. This, over years, started to work gorgeously, absolutely gorgeously. And every time I introduced a new one, I'd be like, give me the bucket of 5. And I would make them chapter and verse. What are the 5? What are the 5? It got so good that we were drowning in false negatives, which is like the greatest thing that could possibly happen. So I would be in my little weird office and they'd come by and be like, Dr. Damour, Molly didn't eat lunch. I'm like, okay. Right? And then we would like put it together with other information. It's very tedious, but we got rid of crises. In a private girls' school, we went 10 years without a full-blown eating disorder. Right? Unheard of, right? And it was fantastic. And here's the thing. They don't want this. They don't want this. They don't want to be responsible for their peers on these things, right? They know this is above their pay grade. And so the key thing that is so important is that we really want to make it so that kids feel that they can tell adults, feel like they know what to tell adults, and that they will. Okay. Let me go. I feel like I'm going to come back to it again at length. Okay. Okay, here's the research stuff that I want to share. Most of our research at the population level is coming from broad surveys, largely CDC, YRBS data. The challenge about these surveys is that they just take a picture in time. They can't ask very many questions. And the newspapers pick them up and take it down the most negative road they possibly can. So we have ended up with a very worried narrative about teenagers. And I'm not saying there's nothing to worry about with teenagers. There is something there. I'm not sure it's the right narrative, though, or that we're characterizing this as accurately as we could be. What I mean by this is that the surveys tend to have internalizing symptoms that they ask about. They tend to ask about depression and they tend to ask about anxiety. They tend not to ask about what we call externalizing symptoms, which is acting out behavior, being hard on the people around you. This is socialized, but the expression of symptoms is very gendered. Girls tend to internalize, boys tend to externalize when distressed. So if we only ask about internalizing symptoms, we get a lot of data suggesting girls are suffering disproportionately. If we don't ask about externalizing symptoms, we don't get those data. So an example of how this went down, and this is really bothersome. You remember the headlines. Girls' hopelessness accelerated at this incredible rate, big jump. 52% of girls are saying they feel, it often gets characterized as depression. Those headlines are on the back of a single question in the Youth Risk Behavior Survey. The question was, have you felt sad or hopeless for 2 weeks or more in a way that made it hard to function in the last year? That question was asked in September of 2021. Okay. So the flip headline could have been, somehow magically, half of teenagers are telling us that they have not felt sad or depressed for 2 continuous weeks in the depths of the pandemic. But that's not what the headline said. So we get this very negative, very girl focused because we're asking about internalized symptoms. And it creates a lopsided view in the media. It creates a lopsided view in the culture. Okay, sitting over here, we have a very distressing finding, which is that boys die by suicide 3 to 4 times the rate of girls. We know this. So you have this incredible disconnect between the discourse and the data, and in part that is driven by the surveys that we have. Okay, so here's what I think we need to do. First of all, we need to ask about both internalizing and externalizing symptoms. We need to ask about, are you irritable? Are you angry? These are the precursors. Usually we think of distress in boys. This is how you're likely to pick it up. We also need to help the general population understand that when we're asking boys if they're irritable or angry, that doesn't mean they're naughty. It means they're in pain, and we need to treat it accordingly. We also need to ask about negative and positive moods. If you only ask about negative moods, you're going to get a very negative picture, right? Teenagers are, if they're developing normally, all over the map, right? Remember how we were up and down? Our kids are up and down. This is the nature of adolescence. So we need to do this because the narrative about teenagers matters. How we talk about teenagers matters. And this is a very old quote, but I love it. There is, however, growing anthropological and sociological support for the concept that society gets the adolescent it expects and deserves. If we are talking about teenagers as though we cannot ask anything of them, if we are talking about them as they are fragile, if we are talking about them as if the girls alone suffer, or teenagers are listening, and we see this, and it happens a lot, and it's concerning to me. And I'm thinking maybe it was a pandemic thing, but then it just happened again last week. Did you all see the headlines about cortical thinning in girls being accelerated in the pandemic? Okay, so there's some data showing that girls' brains age faster in the pandemic than boys' brains. Okay. Deep in the New York Times article, there was a wonderful quote from Ron Dahl, who was one of your previous speakers, saying, we don't know what this means, and it actually might be good, right? Brains, cortex is thin in adolescence. That is actually what they do. They're supposed to do that. It's pruning. This is natural. I'm not a neuroscientist, but I know enough to know you cannot do apples to apples on neurological development in boys and girls in the middle of adolescence because girls have a 2-year jump based on puberty, right? So basically we have this finding, we have no idea what it means, might even be good. Okay. You go back and look at those headlines, it looks like the worst thing that could possibly happen. And then even worse are the photos they put with it. I was looking at CNN, it was like this girl like this. I'm like, holy moly, right? This is not good. And I will, meet with teenagers and I'll be like, you guys, you need to be mindful. Like, the media loves negative headlines about teenagers. If you say teenager, distress, throw brain in there, right? Media loves it. Okay, this is bad. Teenagers live up to expectations, they live down to expectations. It is problematic. It's not even accurate, and it's problematic to surround teenagers with this kind of discourse. Okay, so this is kind of fun. I got to do a survey of teenagers in collaboration with the Walton Family Foundation and Gallup. They were like, what questions do you want to ask teenagers? I was like, oh, I got questions for teenagers. So we surveyed 10 to 18-year-olds about a huge range of topics, including mood. And I was like, well, I have such a beef with all the negative questions. I'm going to ask all the questions I want to ask. And one of the questions we asked was, what did you feel a lot of yesterday? What emotions did you feel a lot of yesterday? Are you ready? Yeah, awesome. So these numbers are 94% on happiness, 91% on enjoyment, and it drops to 49%-ish on stress, and it goes down from there. So teenagers feel all of it. They feel the negative, they feel the positive. My data show they're feeling actually quite a bit more positive than negative. That doesn't mean they don't suffer. That doesn't mean that there aren't kids who, some of them suffer terribly. But if we're telling a story about adolescence, one of the key things we can do at the primary prevention level is to tell a complete story. Okay. All right. Secondary prevention. Now here we're talking about who's eating too much candy, who's not flossing, who do we need to be worried about to head off problems before they start. One thing we can do is confirm that every teen is anchored to an adult at school. a sample of, I think, one of the most brilliant, simple, wonderful programs out there. It comes out of Making Caring Common. This is run by Rick Weisbord at Harvard Graduate School of Ed. They do this relationship mapping at school. It is free. It is free. Schools can sign up. And here's what happens. They give a roster of all the students to all the adults in the building, and they say, indicate which kid you're connected to, all the kids that you're connected to. They give a roster of all the adults to all the students and say, indicate which adults you are connected to. They match them up. They figure out who's not connected. And it's not enough for the adults to say, yeah, we're connected. They need to have it be something where the kid endorses the same way. This is so easy. This is so quick. It is easy on the schools. Schools need things that are easy on them. And it rapidly identifies kids who are not meaningfully connected. And then you can go take care of those kids. You can go figure out what the story is. That is a huge, fabulous, wonderful thing. Okay. I want to come back to the thing I was sharing earlier about helping teenagers let adults know when they're worried about a peer. So I think we can think at scale about doing that. So I did that at the little school where I was. I think we can actually broaden this. So the first thing we need to do, and this loops back to what I was saying before about teenagers really like to know that they're counted on. I think part of the success of programs like this is to say to them, we know you know who's suffering weeks, if not months before the adults, and we need your help to identify those kids. Then, once you've ensured the teens know what to share, so I have my SEL, what I would suggest, we also need to know that they will share it. So as I've talked to other schools about implementing similar programs, like how do you, like, we got it working at our school and there was a high level of trust between the kids and the students and the teachers. That doesn't mean it's easily replicated. Like you can teach the kids all the bucket of five. But then the question is, if they know, will they tell the adults in their building? Here's my advice to the schools. I was like, here's what I would do. Go get your 6 bluntest juniors in a room. Juniors know everything. Seniors also know everything, but juniors still feel like they work for the adults. Seniors no longer feel like they work for the adults. So anytime I had to get to the bottom of something in my clinical work, I would go get myself the 6 bluntest junior. I'm like, give me the story on this. You put the 6 bluntest juniors in a school in a room with the least offensive adult you've got, and you say to them, if you were worried about the health or safety of a classmate, would you tell an adult at the school why or why not? And then whatever you say, you deal with it. Whatever they lay out, even if it's wild rumor and misperception, if it's their perception and if it's the barrier. And kids will say things like, well, we did that once and then we never saw that classmate again. Or something like, who knows? Who knows? But the perception among teenagers is extremely important. You find out what they perceive and you make it right. So I think this is how you can do it at the school level. I also think there is tremendous possibility at the public health level where we could do more public health education around helping teenagers know what to tell adults, as opposed to putting it on teenagers to manage it themselves. And again, I just want to underscore this. When we do this, when we are clear with teenagers about the bucket of five and the adults and making sure they will tell adults, if you ask teenagers what's bugging them, most of the time it's like they're worried about a friend. Right? So it's a mental health intervention, both for the kid who's suffering and for the kid who has the information. Here's my stopgap attempt on this to try to do something at scale. I have a whole bunch of downloadable bookmarks available at my website. Again, super low tech. And one of them is when a teen's friend is in crisis. And there's 2 things here. One is the bucket of 5 is at the bottom. I doubt you can read it, and that's fine. And above that is actually the script for the adult once a kid comes forward. Because the number one thing is we never want a kid to be sorry that they let us know that a friend is suffering. So it's a 3-step script on, you were right to tell me, this is really hard, how are you doing? And how are we going to get the information about that kid to the adults who can help that kid? Do you want my help? You want to do it? Like, we can think it through. So I think this is something that could be scaled through public health efforts and certainly across schools. Okay. Another key secondary prevention thing, we need to take school absence very seriously. These are terrible numbers I'm about to show you. Before the pandemic, the percentage of chronically absent kids was about 15%. The threshold for chronic absenteeism is you miss 2 days of school in the course of 2 weeks. I know. Think about being at school only 4 days a week on a regular basis. But that's the threshold. A lot of kids are way above that. Post-pandemic, so not during the pandemic, post-pandemic, it jumped to 28%. It is coming down very slowly. These are estimated numbers, but we're looking at like roughly a quarter of kids are missing more than 20% of school. Okay. Here, I just want to say for a moment, this is where the media can make me bananas. Because I'm like, okay, cortical thinning in girls, not a thing. Kids not going to school, totally a thing, right? Is this all over the headlines? No, it's not brain. It's not sexy, right? Kids not going to school is on fire. And why is it on fire? Okay, obviously for educational reasons, but if we loop back and for peer reasons, and that's where the adults are who are outside of their schools, right? I mean, out of their homes, kids need to go to school. Okay, so another thing we can do, and this will require heavy funding and a lot of work, is to go family by family and figure out why kids are not coming to school. It's different for different kids. Now, for some kids, it's anxiety. This is actually probably the easiest thing to try to address. Let me start by saying we are great at treating anxiety. It's one of the things that we really have a great handle on clinically. The other thing that happens, I think, that contributes to kids not going to school because of anxiety is that well-meaning adults think they're doing the kid a favor to keep them home. So here's what happens. Kid wakes up, they're super anxious. Don't make me go to school. And you know how it feels to watch your kid suffer like this. Kid's like, I can't do it. I can't do it for any, whatever they're anxious about. And the parent or caregiver says, okay, that's cool. Stay home. The kid feels instantly better. How do you as a loving adult not feel like you're not doing the right thing, right? Like you felt terrible. I said the magic words, you feel great. This has got to be the way to go. One thing we can do that will make an enormous difference is better public education about how avoidance feeds anxiety. So one of the axiomatic things in clinical psychology is that avoidance feeds anxiety, and it's actually a 3-course meal. Course number 1, avoidance feels good, right? I felt lousy, I didn't go, I feel better. Let's try that again, right? The next time I feel anxious, I'm going to come back to it. Course number 2, avoidance lets the daydreams prevail. Whatever the kid was thinking, I can't go to anxiety school because of X, that X remains as frightening as they imagine it to be. Usually when kids get there, it's not as bad as they thought. And then for school in particular, course number 3 is that as soon as a kid isn't going to school, they start to fall out of the loop socially and academically. And it is very hard for them to catch up. Now, I mentioned my husband's a teacher. He's a high school teacher. And I'll tell you, our girls basically have to be bleeding from the eyes to not go to school. Like he has seen how slippery this slope is. He is insistent. And so I think one of the things that we can do that's an easy lift of all the lifts on getting kids back to school is helping adults understand if it's anxiety, going is the number one intervention. I will say to families, you sitting in the parking lot with your kid is better for your kid than the kid being home. It's just counterintuitive. So we actually need to catch people up. But there are other reasons kids don't go. There are kids who don't go because they miss so much school, they don't even know where to start, right? And we need to address that. There are kids who don't go because their family started to depend on their income from working in the pandemic. There are kids who don't go because the timing of when the bus comes requires them to be the ones who takes their little sibling to the bus, given the family circumstances, and so then they don't make it to school, right? So we're going to have a lot of different reasons why kids don't come to school. We need extremely articulated programming to figure out why kids don't go and solve these problems one by one. I think it's interesting. I think, it's funny. I mentioned I continue to practice. So much of my thinking is really driven by first you diagnose, then you treat. And I think so often when we're talking broad public policy, people are like, what's the solution? I'm like, well, it depends on what the problem is, right? And the same problem has 14 facets, and you just need to be prepared to do that accordingly. I also want to try to give credit always where it's due. It's Thomas D. at Stanford, who is the wonk who is on these numbers. And he is doing an incredible job and very thoughtful job of collecting and trying to stay on top of this. Okay. In terms of current approaches that I think we should adjust at the secondary prevention level, I just want to say I don't think our conversation right now about social media is as useful as it should be. There is interesting baseball, kind of inside baseball going on the academic side. with some people claiming that social media has all of this causal implications for depression and anxiety, and other people saying we don't know that, we can't say that, we don't necessarily have those data. That is an interesting conversation. I don't feel that's actually the conversation that is most helpful to families. I do think, rather than treating social media as this broad public health problem, I actually think we can treat it not as a fluoride problem. I think we can treat it as a candy problem. I think we should focus on what we call problematic use. Problematic social media use is a place where there is more consensus on the academic side, and it's actually what we need to focus on. And problematic social media use, when you look at it in the research literature, tends to be defined as compulsive use. We like to sort of look at it through an addiction lens. The way to think about this is like can't stop, right? Kids were using when they shouldn't be using it. As a person who works directly with kids and families, what I find it more useful to talk about it is it displacing things that kids should be doing? And when you talk about problematic social media use in that way, it makes sense to families and it works really well. Okay, so what are the things kids should be doing? Well, they should be sleeping, right? And again, I think there's a really big difference between kids using social media and mental health outcomes and kids using social media that interferes with their sleep and mental health outcomes. And I think it's over here that we need to pay attention. I also think kids should be in real life conversations. They should not be so sedentary. They should be studying with focus, right? All the things that help promote healthy growth and development. If social media interferes with it, it's problematic social media use and it needs to be addressed. But we all know social media also has upsides for kids, right? It's where their friends are. They often are making good connections. For marginalized kids, it can be literally life-saving. So to make a distinction between social media use and problematic social media use has a place. The other thing I am going to put under problematic social media use is exposure to toxic content. Okay, so the grim reality, I know Instagram just put out a whole bunch of new stuff today, and I hope it's great. But the grim reality is once a kid's on social media, they're going to see stuff that is really not good for them to see. And I think there's sort of two categories of teenagers on social media. The kids who are withstanding it, which I think, what's the cost of that, right? You're a kid who's got all sorts of hate content showing up in your feed and you are just finding a way to hold against it, or the kids who are getting sucked down those holes. This is enormously problematic. And I think that it really raises questions about what we're researching. So, okay, so here's what I want to say about the research on social media. What we have generally researched on social media, this is a theme that's going to recur, depression, anxiety, and problems that girls have, body image stuff. We like to research depression. We like to research anxiety. We know these well. We are very comfortable looking at social comparison and body image stuff in girls. We've done it for a long time. Okay, so here this brings us to like this old saw that you learn in your research methodology classes in graduate school. And the story goes, you know, there's a policeman walking down the street and he sees a drunk guy looking under a lamplight. There's a lamp post and the drunk guy's looking under the post. And the policeman's like, what's going on? And the guy's like, I dropped my keys. And the policeman's like, did you drop them here? He's like, no, but the light is here. Okay, this is how we do our research. We look at what we've looked at and we keep looking at the things we've looked at. Now, I think we need to find more lampposts and do more research, especially around social media. I do not know that we're doing very much at all on the impact of exposure to hate content. Okay, here is how I started to feel worried about this. So one of my wonderful opportunities is I get to go to schools. I get to go to schools all around the country. And because I love schools and I love teachers so much, I married one, I try to hang out all day as much as I can. And usually by about lunchtime, it would start to happen in the last couple of years where the head of the middle school would come to me and say, what are we supposed to do about all the 6th grade boys who are spouting Andrew Tate stuff all day long? Okay, Andrew Tate, if you don't know him, look him up, not a good guy. Understatement of the century. Okay, I heard this first in Ohio. I'm like, whoa, you're broken school. Like, I don't know what's going on here. Okay, then I go to the most progressive school in Manhattan. Then I go to the most progressive school, like, and I'm hearing it across the board. I'm like, okay, so we have 400 studies on girls and their mood and social media, and we've got next to nothing on this, and this is on fire, as far as I'm concerned. The other thing we are not studying is that one of the biggest things going on social media right now is these ultra fit, ultra lean things for boys. we are seeing, and again, these are like, these data, like by the time we get them, I'm like, it's too, like, that's so far down the road. Boys are showing up for eating disorder treatment far sicker than girls have been. We are seeing more of them. And the reason they're coming in sicker is they're actually not skinny. They're very muscular and badly malnourished. This is also, I think, wildly concerning. And again, it's not a lamppost we've been familiar with, so we're not spending time on it. I think we should spend time on it. Okay. I will say here, I'm very pleased about the work of Richard Reeves. I don't know if you are aware of his work, American Institute for Boys and Men. It's new, it is fantastic. He is distinguishing himself as somebody who's doing an incredibly good job at looking at hard questions about boys and men in a very even-handed, thoughtful, research-driven way. So there's efforts in this direction. I think the more support for them, the better. And it's so funny. Sometimes people are like, oh, but you do girls. I'm like, okay, well, first of all, teenagers and humans. And second of all, like when boys are struggling, you know who they're often really hard on, right? So like, it's good for everybody if we take care of everybody. Okay, tertiary prevention. I'm just gonna say a few things. So tertiary prevention, here we get to when things have gone to a place where there's real harm, right? Cavity. This is a kid who needs clinical care. This is tricky, and there are some bright spots. And I want to say that. One bright spot is that and this is so in the weeds, inside baseball stuff, we continue to try to reboot the idea of parity in insurance, which is covering mental health the way we cover physical health. We don't nickel and dime people as much on physical health as we do on mental health. So those laws, that legislation, that is important. Another funny little bright spot that gets almost no coverage. I don't know about other fields, but in psychology, we developed a national license in the pandemic. We'd never had that before. It was state by state, so I was only licensed to care for people in Ohio. It's called PsyPact. And it takes a week of your life to get the license. You know, I mean, it's just incredibly tedious. And states are very gradually, almost all of them have legislated their way into this. So now any clinician in any state that has a PsyPact license can care for anyone in any of those states. Okay, what this means for things like rural care, what this means for things like specialized care, right? I mean, how many people are treating trichotillomania in North Dakota? Probably not that much, but it doesn't matter anymore, right? So those things matter. So this is not grim across the board. It's big and tricky, and there are some things that are going well. That said, I want to come back to where I started, which is how many people are caring for teenagers? We need to continue to build out the workforce of people who care for teenagers. There are reasons why we don't have a ton of people caring for teenagers. Teenagers are tricky to care for. For instance, this sort of sums it up. I think about the day when a really fun 17-year-old in my care came in and she's like, this is all confidential, right? I'm like, mm-hmm. And she's like, cool. I'm going to Pittsburgh this weekend with these two guys I don't know that well, but I'm not telling my family. I'm going to tell them I'm over at Jenny's house. Okay, this is why people don't like caring for teenagers, because you're like, oh, okay, this is so far below the threshold of like death, and yet I am so calling your mom, right? Which of course you can't call your mom, her mom, because then of course it blows up your relationship with your kid, right? I mean, so like you have to have a different elaborated skill set for caring for teenagers. Here's what's really cool. You can teach the skill set. And we should put more effort into teaching this skill set. The kinds of things that are very unique in caring for teenagers, technically you work differently with them. With adults and with kids, you can be quieter. Teenagers need to know what you're thinking, right? If you're looking at them without saying a lot, they are trying to figure out what you're thinking. You can just tell them what they're thinking, but you don't do that clinically with other people. Assessment with teenagers is tricky because a normally developing teenager is all over the map. I will say my book Untangled actually lays out a 7-part way of thinking about adolescent development, what we see, what we don't. I developed that actually in training graduate students at Case who were caring for teenagers so that we could home in on where teenagers were really struggling versus what was the wonderfully spicy business of adolescent development that is normal. You also need to learn how to work with the family system. What do you do with that kid who says she's going to Pittsburgh? How much do you share? How do you keep that kid safe without blowing up the relationship, right? And it's teachable, and we can teach it. This is a place where I'm trying to make a contribution. PESI, which is the largest nonprofit CE granting organization, approached me this summer and said, would you like to teach a course on counseling teens? I said, yes. The course, I will give it live on October 18th through PESI. It grants 6.25 CEUs. And then it will live forever as a long, long time as a self-study course on PESI. So I'm like always trying to think of like, what are the scalable solutions that help us be better at caring for teenagers? Okay, I started with the simplest of all things. I started with sleep. I'm going to end with the messiest, really complex thing, which is building a diverse clinical workforce. It is really important that people feel they are cared for by people who come from their community. It is important, it is important. We find ourselves at a moment now where the ethical principle, we have an ethical principle as psychologists and clinicians to deliver a diverse workforce is coming up against a legal requirement that is making that a lot harder. The SCOTUS decision is a problem for this. When I track the conversation in the American Psychological Association around the SCOTUS decision and what it means, this is in terms of you can't do race-based admissions, what it means for the clinical workforce, 2 words come up. First one is devastating. The second is creative. We're going to need to get creative here. Creative can look like lots of things. We are trying to figure this out. Some of the creativity can come in changing the measures to how far have you come from where you started in terms of what you've been able to achieve educationally. Some can come from portfolio approaches to admissions. But we're going to have to get really creative because, as we know, sometimes what's ethical and legal do not line up. And we find ourselves in that position again. I think the other thing that can be done as part of all of this is I think we could commission some pretty serious reports that do a very good job of understanding this pipeline. When we have a diverse clinician come out the end of the pipeline, how'd they get in and how did they not get out? Right? What were the feeders? What are the holes? How do we close as many holes as possible? How do we bump up the feeders? This is really important. This is really hard. And it's what we have to do. So I just want to wrap up here by saying teenagers belong to everyone. Obviously, you're here because you care about teenagers. But I think one of the things that I really hope that we do as a society is recognize that everybody's teenagers belong to everybody. And I feel very strongly that sometimes people think, well, I don't have a teenager. I'm like, yeah, but you know teenagers. Your neighbor is a teenager. You could have a teenage intern in your office. You could be pushing on your legislature for delayed start times, whether or not you have a teenager. So we love teenagers. Teenagers are my favorite. We owe it to them to get it right. And part of how we do that is that we remember that they belong to all of us. Thank you. All right, what questions do you have?
Thank you so much first. I have a lot of questions for you, but I know that we've got a room full of people with lots of questions. So thank you. Wonderful.
Thank you. That was so awesome. I have like so many notes. I didn't know my thumbs could move so fast because I'm not a teenager. But I did write down a question earlier because you were talking about sleep. And I remember your podcast talking about sun for the summer, which I really, really tried to do. But also sometimes it feels at odds with not just the schoolwork, what I'm not like too focused on, but the responsibilities part.
Mhm.
So sometimes I'm looking and I'm like, oh, you know, he wants to do the sport. I want to let him do the sport. Like that makes him happy, but he also needs to mow the lawn and he does need, and his school is pretty progressive. He doesn't have to do too much homework, but he does need to do the homework and maybe the music too. And then he's exhausted. And I'm like, well, maybe which one of these things should we cut back? And then it's often the extra responsibilities that we've put on because like, oh, why don't you just rest? Because the other things are important. So how do you think about reconciling that?
It's really hard, but I think there's some guide. Could everybody hear the question okay? Like if we want kids to sleep and we want them to do all the super cool stuff and also be contributing members who we count on in our families to do things, right? How do we make it all work? So you mentioned our podcast at the end of last spring for sun. Okay, so this is like such a weird thing. Like I have this job where I try to stay very on top of the research and come up with catchy phrases. So for this summer, in terms of restoration, I came up with sun, sleep, unplug, nature, right? Which not bad. I'm glad it's stuck for you, right? I mean, that's the thing. It's marketing. It's getting it to stick. So two ways to slice this in terms of what do we ask of teenagers if sleep is coming at a cost. So one is watch your kids' mental health, right? There are kids who just like have a ton of juice, right? And they can do this and they can keep it up and they're managing okay. And they really are committed to the things and they don't want to give any of them up. And they're happy, they're enjoying, like, you know your kid, right? The other thing I will say is, and I know there may be some sleep scientists in the room who will disagree and feel free. I'm okay with catch up sleep on the weekends. People don't always love that. They really feel like, no, it's important to get up at the same time every day. The issue for when kids sleep in to try to pay off sleep debts, which are real, is that it creates a bit of a time zone issue. And so it can be harder to wake up on Monday if they've basically gone to Hawaii for the weekend in terms of their sleeping. So having raised ambitious teenagers myself who was sleeping, I was like, here's the deal. The first Monday this is a problem, we're revisiting this. But until it's a problem on Monday, I'd rather you get the sleep. The other thing I will say on the responsibility issue is teenagers are so much better than we ever were and are doing so much more than we ever were. I didn't even get into this. We're raising like the best behaved generation of teenagers on record. They do nothing compared to what we did. They are like wildly safe. And I remember the college process, and then I put my kid through the college process. I was like, oh my God. Like I basically like signed something and showed up, right? I mean, to watch kids go through, especially kids, privileged, ambitious process, like it's totally different. So I have zero problem if when your kid is in the thick of it and they are doing all the right things and they are such good kids and they're doing so much, if you're like, you know what, do not worry about the dishes. Like in the summer, the lawn is yours. In the thick of this, we're here for you. And something you can do for the teenagers in your life that makes a huge difference in high school is to let them know they're actually coming into the most stressful years, freshman, sophomore, junior, senior year of high school, right? Freshman year is usually kind of gentle. Sophomore year, as one mother said to me, it's like they just punch them in the face. That was really funny. Junior year is intense. Senior year with the college process is intense, after which it goes down. They don't know this. And the reason it goes down is that when you get to college, as you students know, we don't keep you busy all day in class. You go to class 2 or 3 hours a day, the rest of the day is yours. So part of how you help teenagers withstand that period of time is to help them know it's time limited. And we can also be gentle in those times. You have a question there.
I just wanted to ask about looking at that data and the families are thinking about like things next to, because I know that it can vary. Are you aware of any of the data?
A little bit. So the question is like, where are these kids? What's going on? Are they, because the other thing, we've lost some kids. Yeah, so that doesn't get represented in the absence data, but we are seeing like a loss data. And it's kind of mysterious. And Thomas D has done some very beautiful work on this. I actually saw a very beautiful graphic he did. Okay, why are we like, there are kids who like, the population of kids who show up for school is just going down. So there's a couple things. One is we're seeing a generational, like we have fewer kids of this age, right? So some of it you can account for by just like population numbers. Some of it you can account for by kids who went to private schools in the pandemic, many of which were able to do more for students than public schools were able to do and didn't come back to public schools. Some of it you can account for by increased homeschooling. And the homeschooling piece is interesting because some people homeschool their kids and register that they're doing, and some people don't register that they're doing it. So these are very murky data. Some of it, and I think this gets to a little bit, is fewer people enrolling their kid in kindergarten. Not all communities require kindergarten. And we have fewer kindergartners showing up. And we think some of it, and this is probably very much a post-pandemic effect, people keeping kids closer to home longer. And there's some circumstantial evidence he points to that is more true in communities that do not require kindergarten. So, but then, I mean, this graphic's kind of amazing. And he's like, and then there's all these kids we just can't account for. Like none of the explanations we have seem to make sense. So homeschooling's a piece, but we really have a hard time nailing down exactly how big.
Yeah, so everyone grown when you said the difference between optimal grades and optimal mental health when it came to sleep, it was like 7.5 to 9.
Yeah.
My suspicion is those are the people who are under a lot of stress to try to get into the kind of school they want to get into. We're, as you said, we're in kind of a different world than we used to be. How do you reconcile that with your teenagers?
Okay. So there's a few ways to slice this. The admissions landscape for a lot of families is way better than it feels. I think if we take 20 colleges off the plate, right? The 20 colleges, Stanford's such a good example, that have gone to 4% admission, right? Colleges, we are, Duke. I'm trying to be a good guest, we take those schools off the plate. We are so fortunate in this country to have an ungodly number of absolutely fabulous colleges. And I will tell you, and I'm gonna say this, I'm gonna turn around and contradict it, okay? It really does not matter nearly as much as we think it does where you go to college. And I'll give you a very real example about just kind of quality of education and training. So I got my PhD at Michigan and I taught at Michigan for a long time. Michigan's psych program is like major, right? It's huge, highly ranked, fabulous, fabulous. If you were an undergraduate at Michigan who wanted to do research in a lab, you had to get in a line behind 500 other undergraduates who wanted to do research in a lab, and you might have very little access to the brilliant faculty there. We then moved to the suburbs of Cleveland. I take a job at John Carroll University. Okay, some of you have heard of this, most of you have not. It is this wonderful little regional Jesuit school in my area. Our psych department shared a hall with biology. The Michigan Psych Department was a 4-story building the size of a city block. If you were an undergraduate at John Carroll who wanted to research with a faculty member, you could choose your research faculty member, and you had this incredibly high-touch experience. These kids were publishing papers like it was their job. Their names were coming out on papers. Their likelihood for grad school was going through the roof. And if I had not seen it with my own eyes, my own snobbery would have kept me from seeing that John Carroll was providing a vastly better undergraduate psych education program than the great glory of University of Michigan. So we need to do that. Okay, the piece, I'm gonna walk it back. We have data showing that if you are not white, it matters where you go. Name matters. So I think we have to think about who we're talking about, the level of privilege they enjoy, and then we make choices as families.
Got one question here, and we've got some questions in the chat. So maybe your question,
Oh,
and then
good.
I'll
Yeah.
get a couple questions from the chat.
So I'm the director of college counseling at a area private school. And we used to work pilot site for making caring common for the relationship mapping.
And wasn't it awesome?
It was. And now we're doing a peer mentoring.
Great.
Your relationship building club. Anyways, I'm working on a school-wide presentation about college. And I'm nervous about talking to lower and middle school families. I want to set the tone of how our school really values a rich and unhurried approach that talks about peace. And so you use the term what to expect when they're expecting a teenager. So how do we have conversations with, 6th, 7th, 8th grade parents about it's going to be okay. You have to trust that we're going to guide your child through this, and your child has what they need. They are a whole person they want. So just any advice on messages to give parents as they approach this teen parenting journey?
First of all, thank you for what you do. And this is a hard one. Okay, so if you ask families why they care where their kid goes to college, they will say, and they will mean it, and I have no problem with this, I want my kid to be happy, right? I want my kid to be happy. And often what they are considering to be the source of happiness is achievement and financial security at midlife, right? If you ask, like, where's all this college pressure coming from? It is, I want my kid to be happy, which will mean that they are successful and are financially secure at midlife. Who doesn't want that for their kid, right? Like, these are great things. And they think that's associated with happiness, and I want all those things for my kids. And so I backward engineer that. And what I backward engineer that to is Duke. And then what I backward engineer that to is, what'd you get on this test today? Because you're trying, like, and then I backward engineer that to 6th grade, like, what math are you in? Where's, okay, so that's what, okay. Now, here's some pretty cool research. If you want happiness at midlife, and I will tell you, actually, psychologists, we will not cop to happiness. It's too high a standard. I don't love it. Well-being, right? It's actually not associated with professional success or financial high levels of achievement. Okay. If you find money matters, we see a significant jump in well-being if you go from the poverty level to above the poverty level, at which point it flattens off. You can make $1 million, $2 million, $3 million, it in no way improves your well-being. And in some ways we have seen it corrodes your well-being. Okay, so it turns out that the financial reason actually is not what's associated with well-being once you're above poverty level, comfortably above. And it's not even that big, it's like $10,000 to $12,000. I mean, it's not tons and tons of money. And it turns out professional success is not associated with adult well-being. Okay, but what is, right? If we're saying we're trying to backwards engineer from this point of midlife well-being, what is associated with it? What's associated with it is conscientiousness. People who are conscientious have better relationships. Relationships are associated with adult well-being. People who are conscientious have better physical health. Physical health is associated with adult well-being. And people who are conscientious feel good about the work they do. Whether it's something that the society celebrates, they feel good about it. So what we're going for in midlife are people who have good relationships, good physical health, and feel that their work is meaningful, whether they're caring for their kids at home full time, whether they're, okay. So all of those things are rooted in conscientiousness in early development. So what I would say is, like, say to them, you all want your kids to be happy, we want your kids to be happy. We want them to be happy at 40. These three things: relationships, health, feeling that their work is meaningful. Backwards engineer that. Is your kid an upright citizen? Are they honest? Do they do good work when no one is looking? Focus on developing a child who is a good person, and you will get all that you want. Good luck with that. So easy for me to say is all I'm going to say. Yeah. We have a question from the chat.
So
Yeah.
let me ask a couple questions. Okay. Do you have any recommendations of resources for parents of young adult males who are not doing well? For boys who are not thriving?
Okay, young adult males who are not doing well. So what I would say is, first you diagnose, then you treat. Right, so what's the issue? Is that he's disconnected? Is it that he feels bad about how he's doing academically? Is that he is, in need of a source of self-esteem and it's not coming easily? I would really look at that in high specifics. Does he have an undiagnosed depression? Is he smoking a ton of weed? Right, I mean, like, until you figure out what the problem is, you can't come up with a good solution, but those are a bunch of things I would consider looking at.
Thank you. I'll get a couple more from the chat before we go back to in person. What was the transition from crisis to crisis prevention like to make it successful?
Okay, it was hard. This was in the school where I worked, and we went, okay, so it took a long time. It took a really long time. And it took, every time we reintroduced a bucket of 5 thing, going back to the bucket of 5 things, what are they, having it be just an understood shared thing. We started with a great deal of trust. And I cannot overstate the importance of that. The hardest part was maintaining the trust. Because what happens is, if this is going well, you start to get all this information about kids in the building. So the next thing we did, and this is what worked at this one school. I've not replicated this to a second school, so I can't say this is going to be how it works. The next thing we did is we made sure that all of the adults in the building knew who to tell if a kid brought something forward. So, the nice thing about teenagers is, like, they just go to who they know best and who they like. So even though their English teacher is not on the student wellness team, they'll be like, hey, English teacher, Molly didn't have lunch. And the English teacher's like, okay. So we made sure that all of the adults in the building knew where to pull the information. We brought the information down to a group of like 3 or 4 of us. And it's interesting, and I'm gonna, after the fact, I'll share my slides. I wrote a research paper. I haven't written a research paper for a really long time. And it was actually about this intervention. And one of the things we did is we workshopped it with the students, like, what would help you tell us? And they're like, we need to know that my friend's information is not going all around the school. Like, it has to be to a very small set of adults. Again, 6 bluntest juniors, like they are your best asset. And it would be brought to a small group of us, me, the director of the upper school, you know, people who really like knew what was going on. And then we would take it kid by kid, situation by situation. So somebody would say, okay, kid just came my way, said Molly is not eating lunch. And then they say like, oh, that's so interesting. I just heard about Molly from so-and-so. And then, oh, I just heard about, and they're like, okay, now there's something here. Also, I would come in and say, kid just came in and said Molly's not eating lunch. And the head of the middle upper school would say, yeah, her mom called, she's on an ADHD medication, so she's not eating lunch because she has no appetite. She eats giant breakfast, giant dinner, right? So we had to do it kid by kid by kid by kid, and be very systematic and very careful. And the other thing that we had to do was protect, if they wanted, protect the confidentiality of the kid who let us know. So I'd be sitting in my office, a kid would come in and be like, Molly didn't eat lunch. And I'd say, thank you very much. How much confidentiality do you need? Okay, my favorite was when they'd be like, oh, she knows I'm here. Right? Which is good. My other favorite, and we got to this sometimes, is a girl would say to a friend, I'm cutting, and the friend would say, that's bucket of 5. Are you telling or am I telling? Right, like that is like, I loved it when we got there. Other times kids would say like, she can't know I'm here. She can't know I'm here. Great, you work with that. You work with that. So what we did for eating stuff is we would be like, okay, we got it. And what we would do is we would send an adult past Molly at lunch for several days. And if Molly indeed wasn't eating lunch, the adult would be like, hey, Molly, what's going on? You're not eating lunch. And we would just pick it up that way. Kids would come and say, my friend is cutting. And we'd say, can she know you're here? And they'd say, no. And then we'd say, do more than one of you know? And she'd say, yes. And you also can't tell the kid who's coming to you what you're going to do, right? Like you don't share other kids' information with other kids. We would then say it's Molly cutting, say, Molly, come on in. Your friends are worried about you. Here's what we're hearing. So it was painstaking to maintain their trust. Absolutely painstaking. And I will say for sure, it came up against some of the most complex clinical things in terms of thinking, we have the trust of the whole community of kids. We have this one piece of information. How do we sit in this tension? How do we move systematically? What's the smallest thing we can do to move this thing forward, keep everybody safe? So this is not easy, and it can work.
Thank you.
Question in the room?
Well, personally, I just want to thank you for the books you've written, and it has been a tremendous resource to our family, raising 2 teen daughters now and a rising 9th grade boy. So just a thank you to you. I'm a learning specialist, also at a local area school. And I'm really curious how you're seeing the intersection between the counselors and the more mental health focus and those kids with learning diversities. Because of course we treat or we support students that come into us with a diagnosis. But at the same time, we have a lot of kids on the fringe, right, that have anxiety that present with those same, symptoms of a diagnosis. And I'm just curious how we can partner and serve those students and sort of just your take on this, especially as we see the uptick in anxiety and how we can provide those supports to kids that, are really kind of combusting, but don't walk into me and say, but I don't have ADHD.
Right.
So
I'm glad you're asking about anxiety. So, there's an interesting kind of public discourse problem where both people are talking more about anxiety. They're talking about anxiety as though it is inherently pathological, which is not how we see it clinically. And they're also often talking about it as though it's like a factory setting they're stuck with. Okay, so here's what we know 100% as clinicians. Anxiety is a typical and expectable emotion. Well, where we blew it is we use anxiety disorder to describe the diagnosis and also everyday nerves. We shouldn't use the same word. We expect people to feel anxious. It is actually what keeps us safe. If you're driving and somebody is on your bumper, you should feel anxious. That is what's going to help keep you safe. So there's a lot of messaging to be done around normalizing anxiety, and that we only see it as pathological if it shows up for no reason, or if it shows up in such proportion that it gets in your way as opposed to helps you. So there's that. Then there's the issue of helping people know that it's actually probably the most, of all the things in the whole wide world of clinical pathology, we are better at treating anxiety than anything else. And it's exposure and it's breathing. A lot of it is DIY stuff, but there needs to be a more sort of positive take on anxiety, interestingly, to sort of bring this down. And it's interesting in Inside Out too, for those, I'm going to spoil it. So anxiety is the new main character. And one of the things I was so pleased about is at the end of the movie, after she has spun badly out of control and made things quite bad, they get her under control and they actually put her in a chair. They're like, anxiety, here's your chair and here's some tea. And she's sitting there and she's adorable, which I'll come back to that. And they're like, and this, and they're like, anxiety. And then she's like, but we have that test tomorrow we haven't studied for. And they were like, yes. I'm like, they did it in the film. Anxiety serves a role. It helps us know when something's not right. So the more that we can do that, I will say anxiety in the early versions of the film that I saw, she was not nearly so cute. She was much more of a villainous character. And I was so glad about that progression because it's part of the messaging. Anxiety actually has a place. It's not all pathological. But this gets to what Lucy Folks is worried about, which is if we're talking about anxiety as though it's pathological all the time, kids feel garden variety anxiety and think that there's something wrong with them.
Hi, I'm a second-year undergraduate here at Duke, and so I'm not too far removed from the college application process. It just happened 2 years ago for me, so it's still fresh, traumatic in my mind. And anyway, we all know that it's really important for kids to take hard honors or AP classes to get in, and that that's also just good for their overall self-confidence and well-being. But for my personal situation, I went to a large urban public high school in Pennsylvania, and the way you got into those classes was back at 6th grade, your parents filled out a form and you were put into them. And you could choose to sign up in theory in 9th grade or so, but you had to be, that was a really bold move of you, to go against that system and say, I think I'm smart enough to take this class. And that was, so I guess my question is, how do we get people to, well, first change the system, because obviously that's not a good way to get more people who might be smart enough to take these classes and get into schools like Duke to take them. But also, how do we make them feel confident enough to, challenge themselves?
Thank you for that question. So tracking as fraught a topic as we could hope to end on here. No, it's great. It's great. There are districts that are trying to get rid of tracking. They get a lot of pushback from families who like the old system and whose kids have benefited quite well from the old system. I think there's some early data coming back that it does not harm the kids who have benefited from the old system, and it helps a lot to the kids who were pushed out of higher level courses way too early in their education. It requires more teachers. It requires more people in the room where the work is being taught to meet the needs of all the kids in the room, which are very diverse if you get rid of tracking. This requires that teaching is an accessible and enjoyable and attractive profession, so it can be done. But I think it's just, I think it's a really beautiful place to end, because what you're describing, and I gestured at before, teenagers today are accomplishing so much more than teenagers ever have. What they do in the course of school, what they do in the course of high school, and they are so much more aware of the world beyond themselves. I learn more from my kids about how to be a better, more progressive thinking person than I do anywhere else in the world. When I was a teenager, I was basically obsessed with God knows what, right? I was not thinking about the world beyond me. Today's teenagers are broad-minded. They are working so hard. They are incredibly engaged. They are thriving. They are fun as can be. And so we have to take seriously what it means to have a discourse around us of them as fragile or damaged when they are struggling for real reasons and truly succeeding far beyond any level they have a right to. Based on what we're doing so far, we can do more. Thank you all so much.
Thank you so much. I think we could, based on these questions and the questions we didn't get to in the chat, stay here the rest of the night. Thank you for sharing your wisdom with us. Thank you all for being here. We have a reception just outside here, inside the building, not outside in the rain. So feel free to stay and we can, oh, it's one level up. Feel free to stay and mingle. This recording will be available afterwards for those of you who are wondering about that. And please feel free to join us for future Center for Child and Family Policy events. We have a film screening of a documentary film called Inheritance that's coming up on October 22nd. That's about intergenerational poverty and addiction. That should be it'll be a discussion with the director of the film and one of the boys featured in the film, in addition to the film screening itself. So we welcome you to engage with us in other ways going forward. And thank you again, Dr. Damour.